Welcome to the introduction to barrier management and healthcare acquired infection module. This is the intro. A floor installer and ice cream story. Two things that don't seem to belong in the same box, but hopefully by the time I'm done with this intro, you'll see the connection. Not a while ago, I was at a conference and I was approached by a floor installer. We were talking about professional development. We're talking about infection prevention, and I was speaking to folks about the program. And he came to me with this he had a quandary. He indicated that he started working with healthcare a while back, and he found out about healthcare acquired infections, and he found out about barrier management. He went and received training because of what he does and taking up floors related to dust and related to sometimes hazardous material and things like that. And knowing that he wanted to be a professional, he wouldn't receive training. Pools carpet, does flooring. And when he did his quotes for healthcare, he would quote barrier management in his healthcare quotes. But when he came to me, he was really concerned about the fact that he kept losing bids due to being not the lowest bidder, primarily because of mobilization and setup fees related to barrier management. And he was looking at me in almost a pleading way as to what is he doing wrong. And I really felt bad for him because, candidly, he was doing it right. And we had this conversation about our industry and about different management styles and types, and really talking about how some folks in our profession don't necessarily take barrier management to the same level that he was taking it, and that we're really kind of catching up with healthcare acquired infections and how it applies not just to big projects, but how it applies to these smaller projects. And so, I told him that that's one of the reasons why the Healthcare Facility Leadership Program exists, to raise awareness, to increase professionalism, to continue to grow, if you will, our awareness about the impact of consistently applying methods. Over the years, we are in a big transition when it comes to our perception and our application and our processes as it relates to healthcare acquired infection. There are lots of code and compliance regulation that's moving this way. The CDC, CMS, major organizations are starting to fixate on this subject, and I see it trickling down to the accreditation organizations where the expectations on facilities management are growing. 100% compliance requirements, inner life safety measure, and core requirements that are much more time sensitive than they've ever been. Inclusion inventories that are much bigger than they have ever been. Analysis of water systems that were never there before. And I could go on and on and on, and have actually throughout these courses. And so when this gentleman brought me this query, it really made me pause and think and reflect on my career and on how I had applied principles over the years and how they had grown. And I felt that while I was probably not to the nth degree when it came to barrier management, according to my managers and according to my staff, they thought that I was over the top because I took these things very seriously. We did apply barrier management practices and techniques beyond just major projects. I think the challenge is, when you do a major project, you have a team, you have an infection control preventionist, you have other people in the room, and you're following all of this very thorough documentation that you fill out and you review and you go over. The challenge is what happens when you get into these much smaller projects and these much smaller maintenance activities. I think that's the situation we're dealing with right now. I think a lot of different folks are at different levels. It's my hope that this intro is going to help you with that. So here's this floor installer. And the segue to the ice cream story has to do with where technology is today and where data is today, where algorithms are today. A person doesn't die in healthcare without there being an autopsy, if you will. And so they know why they died. That's how we're getting to these numbers of 75,000 people, dying, and hundreds of thousands of people acquiring infections and their healthcare infection, healthcare health care acquired versus maybe community acquired. Know that hospitals don't want to pay what they're not responsible for. So they will test people to make sure they didn't come in with the infection, which is very common. So they don't have to pay for the infection when it gets discovered or when it presents itself while they're in the hospital. So there's much more focus on where did this infection come from. And that's how we're also starting to drill into the ideal of, where did Legionella, was there any Legionella outbreak in the hospital, or was it Aspergillus, things like that. So this information and plus technology is starting to really, make it more challenging for us, if you will, to deliver at a much higher level. I'm sure many of you have watched, CSI type shows where they go back and they solve these cold cases that are 20, 30, 40, 50 years old using all kinds of various technology. DNA is often used, things like that, where evidence is preserved and they're able to find out, what really happened. One story, and this is the ice cream story, has to do with an ice cream company called Bluebell Ice Cream. And not too long ago, what happened is that there was a serious outbreak of listeria. Now, listeria is fairly common, and it was believed by Bluebell, and I believe by others, that during the processing of ice cream, especially during the code phase, that it killed the listeria, and that it wasn't a danger to people. Well, guess what? Things came together here. As a result of testing of people who passed away in healthcare with infections, they found out that these people in these hospitals had passed from listeria. That came from, yeah, you guessed it, the ice cream. And never before had this been an issue, and it has impacted Bluebell ice cream so severely that they have had to lay off. At that time, they had to lay off about a third of their employees, just to address the financial impact of this outbreak. And of course, it was immunocompromised patients, and that is the common thread. When you have an immunocompromised patient, they're so weakened that things that a normal person can deal with, obviously, they cannot. And so here we are. We've learned one more thing we just didn't know about, and now we know. And unfortunately, it was found out again the hard way. Tying it back to the floor installer, it's the same story. How many times are we going to have to find out the hard way that our practices and our behaviors are contributing to people dying prematurely? So these things are coming together. This is a nexus. These two stories are tied together. They are directly tied to you as a healthcare facilities professional. I think finding ways to implement these things consistently is going to absolutely help mitigate these deaths and continue to kind of wrench down these numbers ever so slowly. At the exact same time, I really do believe that it's going to raise the professional awareness of what we do as a profession. There is a tendency for healthcare facilities to have a get or done attitude, that we can get things done quickly and cheaply, and unfortunately, that also may contribute to the lack of perceived professionalism. We just kind of jump in there and we just knock it out. I think healthcare facilities deserves a higher level of professionalism. I believe that we need to be much more method oriented in our approaches. And again, whether we want to or not, it's coming. And it is my hope that folks in this program are ahead of that curve, and that you are figuring ways to implement and integrate these practices, consistently, and demonstrating a much higher level of professionalism, and obviously with an outcome of being saving lives. Now, it's a journey. This is something that is not embraced by our industry. It's growing. Again, regulatory agencies and healthcare and lots of folks are starting to bring much more focus to this. So hopefully these two stories will help galvanize in your mind how you approach your job. And, it's my hope that, your facility, if you were ever to have, and while you're working, a situation where you did have something happen related to healthcare acquired infection because of behavior, it's not because of your process or your policies. It'll be because someone violated your processes or your policies. So this is an intro. I hope these two stories get you moving for this week. We're going to be covering barrier management. We'll be continuing to again dissect what this means to us in this course and other courses. But again, this is the intro to this week. Hope you enjoy it, and I hope you get a lot out of it. And truly, again, like with Infection Control 120, I believe that the only thing we're going to gain from this, and I'd say that very, very tongue in cheek, is saved lives. Enjoy the module, and thanks for listening to the opening.